Good afternoon. This is Agnes Levine, a Levine-Oliver publisher, and I wanted to talk to you for a few minutes about the healthcare exchange market. Number one, it is up and it is running successfully. The number of visitors to the site has topped 3.5 million, and the website is holding up very good. And so I want to encourage everyone to continue to visit the website, complete the enrollment process, and understand that you must make your payment in order to finish the application process. It is only after the insurance company receives your payment that you will have coverage for health care. And I want to remind you that December the 23rd is the deadline for enrolling in the federal healthcare program. I want to bring you up to date on Maryland. Maryland's website is also being corrected of its technical glitches, and the site is improving. As of Friday, I believe the site has successfully enrolled over 3,000 persons, and you are encouraged to continue spreading that information so that we can get more persons enrolled as soon as possible to avoid the deadline. What will happen ultimately if the persons do not enroll is that they will incur a penalty in the spring, and we want to avoid that. So let's get the word going around in our families and our communities, churches, where we work, where we attend school, vocational school, college, everywhere. Parents especially, ensure that your young adult child has purchased affordable health care from one of the websites. I want to share an experience I had in my family when I delivered a premature child, and healthcare reform was not even thought of, I believe at that time anyway. I delivered my son in 1986 prematurely, and he spent about 6.5, 7 months in a neonatal intensive care unit. Unfortunately, he suffered a brain hemorrhage while he was in the hospital, and when he was finally discharged, he was diagnosed with a developmental disability, and he had profound brain mental retardation and cerebral palsy. That meant that for him, he needed portable oxygen. He needed an apnea machine, which monitored his heart rate so that he would not experience sudden infant death. And he had to have home therapy and a host of medications to sustain him to have a quality of life the way he was purposed to have when he survived his experience in a neonatal intensive unit, including home therapies. So what happened to our family is that my son, and his name was Corey, he is Corey, will always be Corey. Corey maxed out on his health coverage, and he reached the maximum in the category known as catastrophic illness. The insurance company basically said, we're not paying anymore for him to be in the hospital. And while my husband and I reached out to some organizations to help meet the cost that we had to bear, which was well over $100,000, we had to ultimately file bankruptcy. And that was a frightening experience for us, and it certainly affected our credit adversely for many, many years. And it was a constant battle because of the expensive costs with Corey. Then I was employed, and my employer ultimately said after a couple of years that my son was too expensive for their insurance plan, and so I had to make the choice of removing him from the health insurance plan. And so I wanted to bring that up to say that the Affordable Care Act Obamacare, as it is known now that it is the law, will prevent insurance companies from saying a pre-existing condition will not be covered, is the bottom line, and that persons who fall into the gap or into the category of a catastrophic illness or surgery will not be adversely affected or have to worry or be concerned about being dropped from the insurance provider. That's one of the designs of essential health care that Obamacare and your state program will offer. Preventive care, pre-existing condition is no longer a barrier to receiving healthcare costs. There will be no more caps that will cause a family to have to file for bankruptcy and lose either what all they've worked hard for or to be counted out of the race to even obtaining it. If you have a family or you are the head of the family, please make sure that you are covered either in Medicaid, which is extended coverage under the Affordable Care Act, or that you enroll in an affordable health insurance plan by way of Obamacare. This is extremely important. There are things that we just cannot plan and we cannot expect, certainly. And while I was enjoying a healthy pregnancy, it turned to a unexpected delivery, which was one of the main reason, if not the reason, that when I learned about the Affordable Care Act, I made a sacrifice of going down to the Navy Museum in Washington, D.C., while millions of other persons were celebrating the inauguration of our first Black president, African American president, Barack Obama. And that is one of the most precious moments that I will never forget, because I took the trip to Washington, D.C. all by myself to attend the Healthcare for America Now Summit, and was just amazed at the sea of persons going to see the swearing in of the president. And so of course I was joined at the museum by hundreds of other persons who were very passionate to see the Affordable Care Act passed into law, and I will always cherish being a part of that effort. But there's a lot of work to continue. On a federal level, we need to get the numbers up with enrollment, and on the state level, we need to increase the enrollment as well. In Maryland, your state has a program. If you do not live in Maryland, please be sure that your state is getting the word out and the numbers are going in. And most importantly, remember that the payment of the premium must be mailed or sent to the healthcare insurance provider of your choice in order for the health insurance to go into effect on January the 1st and for you to have coverage. So let's get that word spread out, and let's get the enrollment numbers going up, and remember that whatever glitch comes up, as our President Obama said on Tuesday, December 3rd, they will be fixed promptly. So let's not let that stop us from doing what we have to do to get this healthcare enrollment completed by March 31st, 2014. Thank you for having this moment with me.